I'm Dr. Drew Robertson, and I've been addressing a few topics in the current healthcare debate. I'd like to turn now to the likely outcome of a public option as currently proposed, and to a very viable alternative to the public option. I again have to refer to a critical resource in this discussion, and that is a book called Who Killed Healthcare by Harvard business professor Regina Herzlinger. Again, this is a very useful resource with information you won't get anywhere else. With regard to the public option as currently proposed, it is clear that it's going to be very expensive if adopted. Undoubtedly, the expenses will quickly outstrip even the worst projections, and cost containment will become important very quickly. There are really only three ways for the government to control the costs of such a plan. One is to raise taxes. We currently hear that they will not do that, but it seems likely that the government will raise taxes to pay for this. Another is to cut payments to providers. And finally, to ration care. We hear promises that none of these things will be done. In fact, the government will do all three. I've addressed a number of myths in my talks. I'm going to address another one now, and that is that fearmongers are spreading lies and half-truths. Many of these supposed lies and half-truths are in fact projections. They are not part of the current proposals, but it's important to remember that a current Congress cannot bind a future Congress. Many of the things we fear seem likely in the future. The fact is that if we set foot on the path that Britain or Canada has trod, then our healthcare system will end up looking like Britain's or Canada's. Another myth that I hear is that most Britons or Canadians are happy with their healthcare system. How can this be? How can this be the case if they are as bad as people like me and others say they are? This has to do with what's called Pareto's ratio, also known as the 80-20 rule. We've heard of this in our own personal lives. We hear that we spend 80% of our time doing what brings only 20% of benefit. But it applies in other areas. 20% of beer drinkers drink 80% of the beer. It applies to health as well. 20% of the people use 80% of the health care. The key to these other systems is simply keeping the healthy 80% happy. If you do that, your poll numbers will look great. What about the unlucky 20%? Who are they? Well, they are people with serious, chronic, or expensive illnesses and injuries, certain cancers, kidney disease, people who need joint replacements, people who have heart disease, people who have back pain. I know this personally because I treat many people with back pain. And I know that my practice and others like it are under virtual assault from payers and the government today regarding the exploding expenses that go to taking care of people with back pain. In fact, we will even hear from some policymakers that back pain is simply a normal part of aging. The implication is that we don't need to address it. Well, I have to tell you that every day I see patients with back pain who have done all the simple things, who have tried aspirin and Tylenol and simple exercises, and yet they still suffer greatly. Will there be room for them in our healthcare system in the future? How are these unlucky 20% treated in Canada and Britain? Well, they go on waiting lists where they often languish, give up seeking care, or even die without treatment. In Britain, 14% pay for insurance to help them move up the list. They've already paid the taxes for their health care. 14% of them pay an additional premium in order to be seen and treated earlier. Some Canadians come to the United States for care they can't get on a timely basis in Canada. We hear this denied, and yet it is the case. Sometimes they must use connections to move themselves up the list. It's simply the case that if you're connected to the government, to the healthcare system itself, or to the media, you can Raise your voice loudly enough that you'll move up the list and get treatment that others are being denied. What are the consequences of the current path we are on in the United States? Higher costs, less choice, worse care for the sickest. I hope that we will all oppose this. There is an alternative. The alternative is the Swiss model, as proposed by Professor Hertzlinger and very well delineated by her. In Switzerland, there is no government health care plan. There is no Medicare, no Medicaid, no state children's health insurance plan. Everyone is required to own his own policy. There are tax incentives for each individual to buy his own policy, and there are subsidies for those who are still too poor to buy their own policies. The results are remarkable. Everyone has coverage. There's more choice in health insurance plans. The sick get the care they need. And they do all of this on 11% of gross domestic product, rather than the 17% that we spend on health care. What do we need in the United States? A tax deduction for private policy ownership. Subsidies for those who are still too poor to buy their policies. Providers, physicians like me, physical therapists, hospitals, should be freed to bundle their services and quote prices as they will. Currently, we do not have that freedom. We are severely restricted by government regulation in how we charge and how we put our services together. We need publication of performance data. And we need risk-adjusted prices for insurance. That's a technical matter that we don't have time to go into here, but it is well addressed in technical publications like Professor Hertzlinger's book. It will be objected that I can't afford to buy my own insurance. And it is certainly the case that no one can afford the insurance policies that politicians concoct. Professor Hertzlinger uses the example of her own insurance in Massachusetts, where everyone is required to buy the state plan. The premium for that is $17,000 per year. $1,000 of that annual premium is to cover in vitro fertilization. In vitro fertilization is something that some people do need. It's very expensive. It is also something that the vast majority of people will never need, and some people would choose not to use if they did need it. Followers of certain religions have severe concerns about in vitro fertilization. And yet everyone in Massachusetts who is on the state plan is paying $1,000 per year for this particular service. You need insurance that's right for you. You can afford the insurance that you would choose for yourself and your family. Tax incentives are critical in getting there. Choice is critical. A final myth I'd like to address is these people are dangerous. Critics, like me, of current proposals are regarded as dangerous people. I hope that you see that I'm not dangerous. I encourage you to buy the book that I have been speaking of, Who Killed Healthcare? Contact your congressman. Oppose the public option and advocate consumer-driven healthcare.